Imagine going to the doctor because you think you have erectile dysfunction, only to discover months later that it was something completely different. How many relationships, moments, and peace of mind could have been saved if the right diagnosis came sooner? Chapter 1. Why misdiagnoses happen. Many men feel embarrassed talking about sexual health, so they give only half the story during doctor visits. On the other side, healthcare providers may be quick to label symptoms as ED without exploring deeper causes. Sometimes, stress, lack of time, or even assumptions based on age lead to misdiagnoses. Chapter 2. Low libido confused for ED. One of the most common mistakes is mixing up low sex drive with erectile dysfunction. Low libido is about desire. ED is about performance. The confusion happens because both can result in less sexual activity, but the reasons and treatments are entirely different. Chapter 3. Depression or anxiety overlooked. ED is often a symptom, not the root cause. Mental health conditions, like depression, anxiety, or chronic stress, can disrupt sexual function. Unfortunately, if the mental health aspect is ignored, men might be treated for ED when they actually need emotional and psychological support. Chapter 4. Heart disease or diabetes masked as ED. In some cases, ED is a warning sign of cardiovascular problems or uncontrolled diabetes. If the doctor stops at "you have ED" without checking heart health or blood sugar, a dangerous underlying condition could remain hidden until it becomes a bigger threat. Chapter 5. Hormonal imbalances, misread. Low testosterone, thyroid problems, or other hormonal shifts can cause ED-like symptoms. If hormone testing isn't part of the evaluation, the root problem might be missed, leaving patients with pills that don't solve the real issue. Chapter 6. Relationship issues overlooked. Sometimes, ED isn't purely medical at all. Unresolved conflict, lack of intimacy, or communication breakdowns with a partner can lead to performance issues. Treating it like a purely physical problem ignores a major piece of the puzzle. Chapter 7. How to avoid misdiagnoses. Be completely honest with your doctor about symptoms, mental health, and lifestyle. Ask for a full assessment, including blood work, hormone panels, and cardiovascular checks. Consider getting a second opinion before starting long-term medication. ED is not always what it seems, and the truth can change everything. The right diagnosis is the first step to the right solution. Don't settle for a label. Demand the full story.